How can we make sure that we have the right amount of the right PPE in our office for COVID-19? During times of increased demand for personal protective equipment, or PPE, there are strategies that you can use based on your practice's PPE inventory, supply chain, and utilization rate to keep staff, patients, and families safe. If there are no current supply issues, healthcare facilities should not be using crisis capacity strategies and instead follow conventional practices. First, make sure your staff are trained on PPE use and wear the PPE needed for their job. Make every effort to ensure that workers who need to use tight-fitting respirators are fit tested to identify the right respirator for each worker. The CDC has a burn rate calculator, which can help you understand your practice's PPE consumption rate and estimate how long your PPE supply will last. When PPE supplies are low or demand is high, the CDC recommends that the practice consider alternate approaches based on the level of need. This continuum addresses each type of PPE with specific strategies based on where your practice is along the continuum. Conventional capacity refers to strategies that are already in place as a part of everyday infection prevention and control in healthcare settings. When supply shortages are anticipated, a practice could consider using a contingency capacity strategy. These might include extending the use of N95 respirators by wearing the same N95 for repeated close contact encounters with several different patients, or prioritizing the use of gowns for higher-risk medical procedures. When supplies will not meet your expected need, then your practice should consider moving to crisis capacity. These strategies might involve the limited reuse of N95 respirators, gowns, and eye protection. Once PPE availability returns to normal, return to your everyday conventional practices. You may also want to recalculate your burn rate for conventional practices at this point to make sure you will have enough supply as your use increases. Thank you for watching this video.